Well, thank you, Chair DeGette. In addition to dictating what information Title X providers would or wouldn't be allowed to share with their patients, the administration's new Title X rule appears to undermine evidence-based standards of care. And you heard in the before lunchtime, a lot of discussion. The American Medical Association opposes this. American College of Obstetricians and Gynecologists opposes it. American Family Physicians, American Public Health Association, most of our witnesses today, they oppose this new rule. For example, ACOG and 18 other leading health organizations said of the rule that, quote, the final Title X regulation disregards expert opinion and evidence-based practices. Dr. Parrott, do you agree that the final rule disregards evidence-based practices?
Absolutely. We rely really heavily on the evidence to make medical decisions and to help guide our patients. It violates it without question.
Do you think that this rule is likely to lead to more unintended pregnancies?
If we decrease access to comprehensive family planning services, yes, it will lead to decreased access. We heard lots of conversation about hoping that it improves access. We hope that it increases access. We hope that more people get care. The patients that I take care of cannot bank on our hope. They need actual, legitimate services that are comprehensive, that are respectful, that respect their agency and autonomy. They deserve that.
So let's take a step back for a minute and recognize the progress that we have made in the United States of America in decreasing the number of unintended pregnancies. A lot of that success goes right back to Title X, because for about 50 years we've made every effort to ensure that every woman, no matter where she lives, no matter what her income is, has equal access to contraceptives and can make those family planning decisions with her family, her husband, her faith, the doctors, all the healthcare providers. It's been a tremendous thing. That's why it's just so mind-boggling why the administration that voices an intent to decrease the number of unintended pregnancies is doing the exact opposite of what should be done. We should be strengthening the healthcare safety net for women and families. The current Title X guidance specifies that projects, quote, provide a broad range of acceptable and effective medically approved family planning methods and services. Yet the administration's new rule would eliminate the term medically approved. Ms. Coleman, what signal is the administration sending by eliminating this term?
Again, the administration's made clear in the rule that they believe that entities applying for Title X and providers who work in those entities should be able to choose, according to their own preferences and beliefs, what range of contraceptive methods and services will be available. The rule says that explicitly. And so we have great fear that some of the most effective and acceptable methods of contraception would simply be eliminated from Title X funded projects. And that would mean you could come in, perhaps with no idea of what you'd like to have as your method, but want to have a full conversation and be told that certain conversations are not open, this provider's not willing to engage, or those methods aren't available to you.
Do you also believe that if this rule is adopted, it likely will lead to more unintended pregnancies?
I think that's certainly the case. And I want to draw attention again to the fact that the federal government went through a scientific, clear, 4-year process involving both government officials and non-governmental experts. They produced a 50-page report that is available to the public that is based on evidence from ACOG, evidence from the AMA, evidence from the American Cancer Society, evidence from the U.S. Preventive Services Task Force. That is the clinical standard that is in place today, and it is designed to be responsive to clients, but also to help prevent unintended pregnancy.
And Ms. Jeffrey, we don't have to imagine what the impacts of this shift might be. You say in your testimony, should this administration be allowed to undermine evidence-based and client-centered services and interfere with the patient-provider relationship in the Title X family planning program, our experience in Texas shows that we risk the loss of qualified providers and in turn reduced access to high-quality family planning services in communities across the country. So based on your experience in Texas, could you go into more detail about the impact of undermining evidence-based care will have on communities?
Absolutely. As I shared this morning, as a result of the funding and policy changes that happened in Texas in 2011, we saw 82 clinics close, 1 out of 4 in our state closed or reduced hours. 2/3 of those clinics had no affiliation with abortion service providers, and so it was a much larger net than I think was intended to be cast. We saw clients lose services. Again, after the 2011 cuts, 54% of clients lost services. Studies have documented that thoroughly. I think that we also see that whenever we put overly burdensome requirements or the government interferes in the patient-provider relationship, that causes providers to disengage from these programs. In Texas, we saw providers who were not willing to sign attestation forms stating that they did not perform elective abortion or affiliate with those who perform elective abortion simply because they did not believe that it was something the government should be asking of them and that it might violate their ethics and their duties of care. And they also, we saw people not want to sign into a program that didn't allow the coverage of emergency contraception. So again, moving away from evidence-based.
Gentlelady's time's expired. Thank you.